I'd had my teeth out, my upper teeth out when I was 14. In those days, I'm getting on a bit now, and in those days the dentist seemed to take teeth out rather than repair them, And I'd been researching online, and I was looking at South Africa and goodness knows where, and which was a lot cheaper at the time, but where do you go for your repairs when you... And I've got a very hard bite, apparently. They couldn't keep ordinary dentures. I'd keep snapping them, they'd last about, I don't know, a year or two, and then they'd snap in half. So they came up with this chrome cobalt, which was, the dentures were on like a metal plate in the roof of my mouth. And it was okay, it stopped them snapping, but all I could taste was metal. Well, it wasn't initially, but after a while, all I could taste was metal. I don't know whether, whether it was tablets or medicine I'd taken or what. It altered the sort of, that I could just taste metal all the time. And that's what really made me want to change. And of course, I couldn't eat my favourite steak or anything like that. It all had to be sort of minced rather than eating them normally. He explained the procedure very, very well, because initially I went there, I thought that I was going to have pillars down and the teeth screwed to the pillars, which was the old style of implants, which if I'd gone to South Africa, that's what they would have done. But he explained that, if you crack one of these pillars off, they couldn't do anything with them. So the new method was to have spirals put in your jawbone, and then they could screw them in and take them out without any problem at all. So that was very reassuring. Of course, after having false teeth for so long, my jawbone had shrunk to nothing, and he explained to me that he would have to make this up. So it was quite a procedure he had to do with me, because he had to peel all the gums back and introduce the bone sawdust that came out of the holes and pack the jawbone up to take the implants. So it was quite a job, and he done it very, very well. I mean, I was really pleased. I mean, I went to the Rogue went to have a scan prior to, and he done all that before he actually said, yes, I can do it, or no, I can't. It was a very, very, very professional service, to be honest. I can eat anything and feel safe. I don't know, you've probably never had false teeth, but they're floating about in your mouth. You especially having them for so long, you cannot get a firm grip on them. They just and like the things, you can't eat nuts because they go under them. You can't eat strawberry jam because the seeds go under them. It's and when you're ill after the beer, you can't you lose them then. The implants, they just feel as though they're part of your mouth. There's no it isn't just something that's stuck in your mouth. It really does feel part of you. I'd recommend Nigel Jones Smiles Better to anyone because of the professional service they gave me, the aftercare. I mean, I've got his private mobile phone. If I ever need it, I know that he said, just call me. I never needed it, but with that reassurance, it's, and I have recommended a number of people, and a number of people have rang me up on Nigel's Jones's advice, to ask what I thought of it, as a second opinion sort of thing, not to take his word. But Nigel Jones and Smiles Better, I find fantastic.